The federal government, through the Ministry of Health and Social Welfare, has announced the launch of the country's inaugural State of Health report. The minister revealed this development in a press briefing in Abuja, explaining that the report will act as a collaborative platform for stakeholders to engage in dialogue and jointly devise strategies to enhance Nigeria's healthcare system. He emphasized that the initiative is not aimed at placing blame, but at fostering a collective approach to strengthen the sector through shared insight and coordinated planning.
The President witnessed the federal government sign a compact with state governments, with our development partners, that put us on a path, the sector-wide approach that we have been on. And as part of the compact, we agreed to enhance the mechanisms for holding ourselves accountable to Nigerians in terms of the services and the improvement that we are seeking to achieve. Since then, we have taken important steps, and the joint annual review is one landmark event. It's the first of its kind, where we are collectively coming together to review the results that we have been able to demonstrate or begin to show on a much larger journey that is ahead of us of transforming Nigeria's healthcare system. And we have had quarterly performance dialogue with states. We have had multiple engagement with state governments, with commissioners of health, with our development partners, through various working groups, which have looked at the data. And we have used instruments such as the People's Perceptions Survey. Last year, when we set the agenda, we had a People's Voices survey that was conducted, interviewing almost 2,500 Nigerians to get their perception. Because if you recall, the first pillar of the agenda is to improve governance and to orient Nigeria's health system to respond to the needs of Nigerians, which is the President's renewed HOPE agenda, the Health Sector Renewal Investment Initiative. And this year we have a perception survey which is conducted in across the 36 states, interviewing more than 2,600 Nigerians as a sample to get a sense of their perception on our way to continually assess how do Nigerians feel about the health system and the impact of what we are trying to do. And that will be reviewed next week at the joint annual review. We also have data, because it's important to track objectively. We have now gotten the result of 2023 DHS, which is like a baseline, which has now been organized systematically across different states by different indicators to tell what has been the trend, so that in 2 years' time we can reliably come and say, okay, this improvement that we're talking about, here's how much we've achieved, here's how much we may not achieve, here's what we have learned. Because it's important that we have those matrices that we can track our progress. That is also something that will be discussed next week during the joint annual review. And that was a collaborative effort across different stakeholders, Ministry of Health, the SWAP office, our key agencies, our partners, looking at the data so that when we talk about numbers, we know the numbers that we are talking about. There are other blocks of work that have been going on over the last 12 months in reproductive, maternal, newborn, and child health. Understanding where are women dying, what are we doing about it, how are we changing the interventions, the retraining of frontline health workers, how is it going? On HIV, TB, and malaria, where are we? On preventing mother-to-child transmission, where are we? On commodities, how is the situation of stock of commodities? How do we crush maternal mortality, given where mothers are dying? Because we realize that mothers have risk of dying in Nigeria, not equally in all parts of the country. There are particular local governments, about 172 of them, which account for more than half maternal mortality. So how do we target them now that we have identified them? So let's review it collectively with the best intervention that we can deploy. How are we doing on the infrastructural upgrade that we said? How are we doing on the health security pillar of our agenda? Now, with the resource that we've raised, we need to look at where do we go from here in terms of the annual operational plan that have been developed by the states. Those are the kinds of things that the joint review will interrogate by government, us, our teams that have been working very hard, our development partners, our partners at the state government, local governments. Of course, the citizens' voices are included, and the culmination of that will be the first state of health report, which will be the first time there will be a state of health of Nigeria report. And on an annual basis, that will now be like a report back to Nigerians, because all of this is to serve Nigerians and to report back to His Excellency Mr. President, to the members of the National Assembly, and we would come out of the joint annual review to go to the National Council on Health, which is the apex health policy making body in our fiscal federalism.